Good afternoon.
Good afternoon.
How you all doing?
Good.
All right. Is that right? That's not bad for New York, all right?
Uh,
So you've heard numerous times Clubhouse or Fountain House mentioned. Janet, my friend DJ, my friend Cheryl mentioned it numerous times, and a couple other speakers. So let me tell you a little bit what the model is. It is defined as an intentional community. So what does that mean? It means a place where people can come and be accepted for who they are at this point in their recovery, okay? And it is a place with a purpose. And we believe that it creates community, and community is one of the keys, as you all know for yourselves, it's what we're about. We all identify in our community in some shape or form. So community is key in our belief and in our experience to keep people with serious and persistent mental illness in treatment and to be moving forward with their lives, okay? So that's kind of the overview. You know this number, so I'm not gonna spend any time on that. You've seen it over and over again. Our staff, we define them as social practitioners. And what is social practice? Well, you see it up there. It is a specialized form of environmental therapy. And we use the community as therapy. Again, I'm gonna keep repeating this concept of community because we think it is an essential component in keeping people that otherwise have been pushed to the side, have been discriminated against, who have been thrown on the heap pile because honestly, most people don't think that people with serious mental illness can contribute a whole lot. We have elements of social practice, and again, I'm limited by time, but engagement, because for many of our folks, it's gonna be the first time that they're gonna be accepted for who they are and actually appreciated. One of the big differences that you're gonna see when you walk into a clubhouse is an expectation that you give back. We are not there to treat you as a passive recipient, but we expect you to become an active participant, okay? That's kind of the key about engagement. Relationships are key. Knowing people over the course of time. Social design, that has to do with the way the clubhouses are created. For example, our culinary unit, our kitchen dining room unit, working side by side is important, where it's not only about creating the lunch, we definitely want to eat, but it's about how we interact, staff and members. And they're not patients or clients, but they're members, right? So there is this collegiality. And if you remember from the first slide, I would challenge you to tell me who's the staff and who's the member, okay? And that's part of what we do. And then we have this continuous assessment and transitional environments, which means when we try to get people out of the clubhouse, either back to work or back to school. So again, you're familiar with many of these words, keywords for recovery, but what I really would want to underscore again is side by side. It's kind of this concept of mutual help through self-help as we work together and as we try to get people who, again, historically have not had a lot of opportunities, have not gotten a lot of respect, showing this collegiality, this respect, and asking them to participate and to really give back to what we're doing. So this is our dream, right? This is what we see in everybody. And we know everybody is not going to get back to school. Everyone is not going to get a job, or at least maybe not in the immediate future. But I want to just remind us all that as we speak of today, we do not have the instruments to determine who can recover and who can't. So I appreciate when DJ says there's a lot of talk about recovery and it's not happening. And that's true, because oftentimes it doesn't. But we don't have a blood test, we don't have a CAT scan, we don't have a PET scan, we don't have a zebra scan, we don't have any scan, right, to tell us what's really going on with individuals. So that's why we believe that everyone deserves a chance. But as you know, our mission is exclusively to work with individuals with serious and persistent mental illness. The model was really designed to work with people with schizophrenia. That's really who we are and what we're about. We also, I think, do very good work with folks with bipolar disorder and also major depression. So this slide, and I really want you to focus on the right side. In my opinion, as a psychiatrist, okay, the right side of the slide is the most important part of what we're talking about. You all hear about the buzz, about social determinants. Well, You could be the best endocrinologist in the world and working with your patient with diabetes and finagling the insulin and the this and the that. But if your patient lives in a food desert, that diabetes is not going to get better. So we understand the need for acceptance, for community, the need for employment, the need for education, and really getting people to believe in themselves and going beyond the fact that they can't, all right? We have an integrated clinic. We've been doing this since the year 2000. I think we were one of the first to have a primary care physician embedded in the clinic that worked exclusively with folks with schizophrenia and bipolar disorder. We've learned over the years, and we published a paper together with the World Health Organization, that we know that the most expensive aspect of treating schizophrenia in particular is not psych. It's not ER or psych inpatient. It's the medical comorbidities. That's what costs the most. It's uncontrolled diabetes. It's uncontrolled cardiovascular disease, all right? Those are the most expensive aspects. These are some of the data that we show in respect to the general population. We were able to show a 21% decrease in utilization costs as compared to the general serious mentally ill in the city of New York. Jim Nickman did this study. This data shows you a little bit about the cost, what it costs to have a member come to the clubhouse on a yearly basis. And you know the other costs. They were eloquently presented by some of the other speakers. And finally, what I really wanted to underscore is that we're working with people through the entire life cycle. We start with folks from the age of 16, and we go into the golden years. We most recently started what we call the Silver Center, where we understand as people are aging, we need to provide them with other services. It can't just be coming to the clubhouse and being part of what we call the work order day. So that, by the way, in the middle is one of our members at a wedding with their parents. So basically, we believe that we are a very good model. We may not be able to address all the needs, but we certainly think that clubhouses could be a viable solution to many of your problems, many of the issues facing people with serious or persistent mental illness, and we know that it can cross both low-income, middle-income, and high-income countries. I'm going to thank you for your attention, and I hope to hear more from you later in question and answers. Thank you.